Everybody can see my screen?
It's still loading. Yeah, now I can.
Okay. So we will start with the menopause, but before we start, I want to introduce myself. My name is Vaidya Meenakshi Gupta, and I'm a Ayurveda practitioner, BMS in Ayurveda from National Institute of Ayurveda, Jaipur. And I also am certified in nutrition science and child nutrition. And my expertise is in Panchkarma, which is a detox. And I'm a founder of Ayurroots Ayurveda Wellness Center and Siamore Skincare. Been in practice in Dallas area from past almost 3 decades. Um, and little disclaimer before we start. Um, Here we go. So the information which I'm going to share here, can you see the slide change or no?
No. Yeah,
Now?
now
Now
I
it changed.
yes.
Okay. Okay. So the information including but not limited to text, graphics, images, and other material contained in this presentation is for educational and information purpose only. And this presentation is not intended to make any claim regarding any treatment or any other medical condition. And it is not intended to be substitute for professional medical advice, diagnosis, or treatment. Always seek your primary care physician or the OBGYN if you have any question or concerns regarding your medical condition or treatment. Now, when we talk about the women's health, I love this quote from the Michelle Obama. Communities and countries and ultimately the words are only as strong as the health of their women. So if as a main person from the household, if we are not taking care of ourselves, then how we are going to take care of our family? Women are considered as the strong pillar for their family. So it is very, very important for all of us to make ourselves as a first priority, especially when you are going to transition from one stage of the life to the another stage of the life. And many of us, we ignore ourselves because either we are busy with the kids, busy with the household chores or our office jobs, or taking care of multiple responsibilities from cooking to cleaning and everything, managing the household or managing the businesses or the offices. So it's very, very important that we put ourselves in the first priority, and that's how we can raise a better community or healthy community. What does woman health means in Ayurveda? If you see, women bodies are very, very complex, and on the other side, we are powerful also. We start with menarche, which is the first menstrual cycle when you get it. Then, at the appropriate age, we go through the pregnancy, preconception, pregnancy, then post pregnancy, delivery, postpartum phase, early motherhood phase, and then perimenopause or a menopause. So, you see, as a female, your body goes through one change to the another change. Means along with the physical changes, we also experiences the mental changes also. A lot of stress associated with the pregnancy, a lot of mood swings associated with the early menarche and during the youth time period. How we adopt whatever the life is offering us, that's and how we can balance everything naturally. That's what Ayurveda tells us. So, Ayurveda offers as a wealth of practical knowledge to help us stay balanced at every stage or age of our life. Now, many of you might have heard the word Ayurveda, but what the Ayurveda is? Ayurveda is Indian system of medicine. It is a 5,000-year-old science which is originated from the Vedas. And the literal meaning of Ayurveda is Ayu means life, Veda means knowledge, which gives us the knowledge about life. In a broader aspect, if you see, that means what is good for us, What is not good for us means hitam ahitam. Hit means balancing for us. Ahit means which is not conducive to us, which can impart the dukkham. Dukkham means which can bring the imbalances and gives us a trouble also. So all these things are mentioned in Ayurveda. And Ayurveda also tells us how to maintain the longevity and how to incorporate three sub-pillars of life, which is diet, sleep, and proper use of senses also. Because later you will understand why these three sub-pillars are considered as a sub-pillar and why it is so important to maintain those three sub-pillars throughout your life, not only for as a female, but for every human being. Now, many of you might have heard the word dosha type or the prakriti. So, in Ayurveda, we say that there are three types of doshas: vata, pitta, kapha. So, all these three doshas are basis upon the five elements, and these five elements are air, ether, space, water, and earth. At the time of conception, when mother conceives the baby, based upon parents' diet, both the parents' diet, lifestyle, stress factor, environmental factor, place of conception, time of
You
conception.
may know some of this, right? So money,
Please mute yourself.
process is step by step will grow over time, over a period of time. So we will talk about all that in the subsequent section, right? The financial concepts, right? Because what are different financial issues? All the areas of life in the different than
Vidya, can you mute?
Can you please mute yourself?
people getting out of college. Some people just kill young kids. Everybody has a different goal. What are
We started
I
something
I
with
have I have tried
this kind of
muting
thing.
Vidya a few times and then it gets dislodged and she comes back on. So I'm not sure what's going on.
Um,
Who is it? Any idea? Did you see the name?
But we put some money in the retirement fund, I think we did.
okay, I have muted her. Let's see. Uh, so in Ayurveda, we say that there are three body types based upon the five elements. And those five elements I already explained. At the time of conception, based upon the previous factors, when mother conceives the baby, based upon how the all the five elements are, either the person can get vata dominant, pitta dominant, or the kapha dominant, or they are vata pitta, pitta kapha, or vata kapha dominant, or they are all the doshas are in the same proportion. To give you a better understanding, let's assume you are a family of three going in the car. So only one person can drive at a time. So that first person is your dominant dosha. The second person either have the choice to sit at the front or rest of the people will go at the back seat. So that's how the dosha constitution is. And when these doshas are there, then we have called as a prakriti, which is your unique genetic code. Nobody can change. And that is based upon previous factors. And these are going to stay with you throughout your life. So if I am pitta dominant, so that means pitta is my constitution. Nobody can change that. But the Vikruti is, which means the imbalanced can be changed based upon how I am having my diet, how the lifestyle is, which season I am, and what type of lifestyle and exercise and all those routines I am following. That will put me at the risk of having different Vikruti. Now, Prakriti means your natural constitution is either physical or mental. Physical means which is related to seven types. Mental means there are three gunas associated with the physical, which is sattva, raja, tanma. Sattva is associated with pitta. Raja is associated with vata, and tama is associated with kapha. So, Sattva means which is pure, purity, sattvic. Raja means where there is a lot of movement. And Tama means where there is a stagnation. So these are the two. Uh, Sharirik and Mansik means physical and mental constitution, and it plays an important role. Mental constitution, one can change. If you are born with the Raja, you can change into Sattva or Tama. If you are born with the Tama, you can change into Sattva and Raja. But the physical constitution, we cannot change. So now, if somebody is Vata, Vata is responsible for movement in your body. So whatever is moving, like I'm talking, my tongue is moving. Many of you might be nodding the head. That is a movement, joint movements, walking, talking, everything, the food travels through your body. Then the elimination, defecation, menstruation, all are moving out of the body. That is the energy of action, transportation, and movement. And Vata people, if you will see the picture also, they are lean, they are long. It's hard for them to put on the weight. And they talk very fast, they walk very fast. Their mind is always racing. If they are doing multitasking, it is very hard to control them. Properties of Vata is it's a combination of air and space. So that means it is dry, rough, light, cold, subtle, and mobile. Always movement. If you see the Vata person, if they are sitting, you won't see them 5 minutes just staying still. It's hard for them mentally and physically to stay still. Personality of Pitta Prakriti, Pitta people, that is the energy of transformation, conversion, digestion, metabolism. That is mainly the energy which represents your digestive system, where it is your stomach function, small intestine, liver, gallbladder, pancreas. Pitta is also responsible for your skin color, hair color, eye color. Pitta's properties is it's a combination of fire and water. So the properties are it's oily, it is sharp, hot, light, moving, liquid, and has acidic smell. Pitta people, if you see that, they have very glowing skin. And they are more prone to acne also or the skin disorders if they are not careful about their food. They love spicy food. They cannot sustain hunger. If they are hungry, they want the food right away. Other than if they are not getting the food, then at one point they will be hungry, angry. So that's the personality traits for the Pitta people. Now, the Kapha Prakriti, if you see the picture also, Kapha is the energy of cohesiveness, wherever we need the lubrication or the joint movements or the construction, nourishment, that is the kapha. Liquid in your body represents kapha, means saliva, which plays an important role in the digestion, lubrication in the joints, synovial fluids, cerebrospinal fluid. All the fluids in the body and the mucous membrane represents your kapha. Kapha Prakriti people, they have broad shoulders, broad hips. They considered in Ayurveda as a good people, but they are little lazy. It is easy for them to put on the weight, but it is very hard for them to lose the weight. They have tendency to go into the depression if they are not moving frequently. And the properties are of the kapha itself is, since it is a combination of water and earth, so it is heavy, moist, cold, little dull, little soft, sticky, and static. That's where the movement is very, very important for the Kapha people to maintain the wellness. Mansik Prakriti, as I said, it is based upon the menstrual constitution is based upon the three guna, which is Sattva, Raja, Tama. Sattva means purity, Raja means lot of movement, Tama means no movement. To understand this part, let's assume the analogy of a lake. Imagine you are at the lake. It's a nice environment. You can see the fish swimming. You can see the clear water. Even the grass inside the lake, you can see that. That much clarity is there. That is the sattva type of mind. Now you see the storm is coming. Everybody is scared. The fishes, the animals in the pond is they are scared. There is a lot of movement. Water is moving. Trees are moving here and there. Dust is flowing, and that is the raja quality of the mind. Tama, after the storm has been passed, you see that the pond, which was clear, is filled with mud now, and you cannot see anything. Nothing is seen because it is full with mud. And that is Tama quality, where the things becomes dark and nothing is clear. So all these three are always there. But as I said, these are the three from one state to another. It's easy to change that constitution based upon our diet. Certain food are helpful for the sattva, like for example in Ayurveda we say that um, the ghee, clarified butter, or the milk, those contain sattva property, pure properties. Non-veg is considered as a tama dominant. Raja, a lot of spices will constitution towards more towards the raja. So if you know these, it's very easy to alter the diet and go into the sattvic stage of the mind also. And as I said, in Ayurveda, if we see that the female body and mind undergoes significant changes as one person transit from one stage of life to the next life. And this journey involves profound anatomical, physiological, and psychological transformation. So this is the transformation which we all see at one or the other stage of our life. And that stage starts with, at this age, perimenopause. Perimenopause means before or around, surrounding, near the menopause. And that means it is the end of the reproductive years. And perimenopause also refers to the time during which the female body makes the transition to the menopause, also known as menopausal transition. So you were in the youth phase, or many of you might be still in the youth phase, but once you cross the 40, the body starts preparing for the next phase of our life, which is a perimenopause phase. And depends upon your family history, your mom, your aunt, or your elder sister, the age can be variable from one person to another person. So what is perimenopause? As I said, it is before the menopause transition. If we see the conventional medical aspect of this, what happens? Ovarian function starts to decrease, and that causes the change in the estrogen and the progesterone level, which alters many physiological actions that might cause the different symptoms based upon how our body is, or I always tell how well we have kept our body. It all depends what we were doing before 40 years. That's how our perimenopause or menopause phase are gonna be. And it is variable. Mostly it takes either from 2 to 10 years based upon the clinical research. But as I said, genetic factor also plays an important role. That was the perimenopause phase. After the perimenopause, there is a menopause phase. Menopause is a normal natural event defined as the once your final menstrual period is gone and you have no periods for up to 1 year, that is considered as a menopause phase. And it represents the permanent cessation of periods resulting from loss of ovarian follicular function, means estrogen level goes down, and even the progesterone also goes down, but basically mostly because of the aging, the estrogen level declines. When in menopause, naturally, spontaneously, average age 51, but can be variable based upon the genetic history. And sometimes it happens prematurely from medical interventions. Sometimes people have uterine fibroid or other medical reasons where the total hysterectomy can cause the early menopause also. Now, stages of menopause, if you see, now it is perimenopause, menopause, and postmenopause. And everybody, most of us are going to experience or have experienced these three stages. Now, post-menopause, the year after the final menstrual period resulting from natural to premature menopause, with current life expectancy, we see that the postmenopause year have make up to 1/3 to half of the lifespan of most North American women. And that is from the research which I quoted here. If you see the, this is the picture of the location of the estrogen receptors. So if you see the estrogen receptors on various part of the human body, brain, breast, eyes, genitourinary tracts, heart and blood vessels, liver, ovaries, skeleton, skin, and hair. So typically, if you see, everything in the female body has those receptors. Once we lack the estrogen, based upon which area of our is weak, we will get the symptoms according to that. And many times, sometimes we experience all the symptoms also. Hot flashes, disturbed in sleep, irritability, mood swings, breast heaviness, or sometimes it leads to the breast nodules or breast cancer also. Macular degeneration, eyesight gets weak, urinary tract, urinary incontinency, vaginal dryness, plus we see a lot of discomfort during the intercourse also, and also loss of muscles in the pelvic area, which lead to the urinary incontinency, means people cannot hold the urine as compared to what we used to do. Then cardiovascular diseases, your lipid profile can change in that. And also weight gain is also there. Skin start taking, it takes tolls on the skin also. Skin sagging, or sometimes it is loss of muscle mass also happen. And osteoporosis. I will emphasize on osteoporosis because most of the Asian women, Indian Asian originated women, are more prone to osteoporosis as compared to the other symptoms. These are the short-term symptoms, and then based upon the age, there can be a long-term symptoms also, and that get converted into disease if we are not taking care of early in our life. Hot flashes. Um, Many of you might have experienced hot flashes, sudden body temperature changes, and sudden onset of reddening of the skin, or sometimes drenched in the night in the sweat also. People will say that, oh, I need the comforter. But if the female is going through menopause, she might ask for, can I have the extra fan? Or can I lower the temperature of the air condition? So that is the number one complaint we see during the menopause. Few seconds to several minutes it can stay. And sometimes it is not there. Other symptoms are there. And but many of female, they experience this symptom, and more common during the night time, also more common if you are already stressed out for some reason, and also very common if a person is overweight. Normally it lasts for up to 1 to 2 years, but sometimes it dragged on up to 5 years also. Sleep and mood disturbance, lack of sleep sometimes, and also stress also plays an important role during that time period. So wherever you need the help, ask for the help for the sleep and the mood disturbance. Meditation, outdoor time, doing the regular exercises also helps. And many times we see that even the research back up this thing, that women with a history of depression during this phase of the cycle, they there is tendency to go into the depression more. Then cognition, also forgetfulness. Sometimes it is like you can't remember the name of the person, or you can't remember where you kept your keys or something like that. And many times we see that the foggy memory also can happen. And the chances of having the dementia over the age of 65 is also increased if we are not careful about our intake of the right diet, lifestyle, and mental health. Metabolic changes, as I said, we see that overweight also increase fat accumulation, which leads to the especially pear-shaped body. Most of people adapt if we are not doing the proper exercises, and loss of muscle mass also. And this is the metabolic syndrome where the lipid profile also changed, insulin also secretions changes, and other factors also. Blood pressure starts increasing if we are not careful
Timer aikada.
about our diet. Osteoporosis, this is on the left-hand side, you will see the natural normal bone, but here it becomes a porous if we are not careful about our calcium or vitamin D and other factors. Consequences of osteoporosis, most of females goes into the back pain, chronic back pain, and especially in the lower back, loss of height and mobility. And that also puts us for the risk for the fractures also. Hip fracture, forearm fracture, and tooth loss also. How we can prevent? Talk to your primary care physician regarding what type of calcium or vitamin D you need to take. Weight bearing exercises, if somebody is taking alcohol intake, may be reduced there also. And check your genetic profile, risk history also. If you are on certain medication, discuss with your primary care physician or OBGYN, hey, if that is going to lead to the osteoporosis, or how I can prevent the osteoporosis if you have a family history. And smoking also impact the osteoporosis. Changes in the urinary tract system, if you see, as I said, there will be a vaginal dryness because the lubrication fluid, it decreases. Vaginal elasticity also decreases, and there is a thickness of epithelium, which leads to the narrowing of the passage or atrophy, and a development of urethral caruncles, which means that is a growth, which can lead to the burning sensation or discomfort, or also mucosal thinning of urethra and bladder. Not everybody experience this one, but these are the symptoms one can experience. So that means painful urination, urgency, frequency, put you at the risk of urinary tract infection, difficulty in intercourse, itching also, and stenosis also. Stenosis means narrowing of passage. In Ayurveda also, we say that female has different stages of the life. And those stages, newborn to 10 years, we call it as a kanya. Those are the Sanskrit words or Ayurvedic words. 10 to 12 years, bala, which is still growing. 12 to 14 years, it's the time period when the first periods comes. 14 to 16 is the adolescent. 16 to 14 is the youth age. 40 to 50 is the perimenopause. And 50 plus is the postmenopause. These are the stages described in our Ayurvedic books as per the sages. And Ayurveda always celebrate transition and this age period being an important state of the woman's life. So there is a term for that is called as a sobhagya, means you will gain the wisdom. You will let go of the reproductive age, but you will gain the more wisdom. So in Ayurveda, we say that it is a Rajo Nivritti. Rajo means, again, the periods. Nivritti means cessation of the periods. And as per Ayurveda, we say that it is based upon your time, where means the age. You are entering into the Vata stage of life. There is going to be natural depletion, and that is natural. Nobody can change that. It is inevitable. Means it's certain things which happens naturally, like you will get hungry naturally, urination, defecation, sleep, all those are the natural, and this is also a natural. And also there are other causes like surgical removal and all with the early intervention. Those are also the causes of menopause in Ayurveda. So the life in transition. I love uh, this phrase because as a Ayurveda practitioner and as a female, I have seen, I can proudly say that from Kapha to Pitta, Pitta to now entering into the Vata stage of the life, and a lot of learning. Kapha stage is birth to puberty, Pitta is puberty to perimenopause, and Vata stage is perimenopause to end of the life.
Dr. Meenakshi, there's a couple of people waiting to be let in.
Yes,
Could one of
please.
you
Yes,
let them
please.
in, please?
Yes,
Thank
yes.
you.
Yeah.
I only see one, and it's always Vidya. I'm sorry, I'm trying to get everyone in, but it's only Vidya I see.
So it's see, my name is Vidyadra, and I'm the one who has talked to Meenakshi and gotten the session going. There were a few who were not able to access the emails at that point in time, so I had to share my link with them so that they can join the session. That's why you see my name there.
Oh, okay, that's good to know. Yeah, because there was like 7 Vidyas, and I keep entering
Yeah,
some Vidya. Okay,
they've all
thanks.
registered. Yeah, they've all registered, but the thing is that they're not able to access the email, so I had to share my link with them and through WhatsApp, and they have joined. But I will
Awesome.
make sure that Dr. Meenakshi receives everybody's email ID as we discussed before.
Thank you. Sorry about that.
No worries. So kapha stage, if you see the child, infants, they are more prone to cold and cough. Uh, that's the stage of the life. It is called as kapha stage. Pitta is, if you see the pitta character is fiery. Most of the youth or the teens are fiery, especially the girls, if you see that. They love spicy food, and lot of indulgence in certain things. And the Vata stage is where we transition uh, till the end of our life. Why the menopausal discomfort occurs, as I said earlier, this is the natural transition from the Pitta phase of life to the Vata stage of the life. If we are not careful in our earlier stages where we are indulging in certain things, we all do that. If we are doing that, and if we are not careful about what we are putting in our mouth, what we are putting in our brain, and the lifestyle, everything comes back to us during this stage of the life. So I always tell, make sure that you have 3 things in your under your belt: right diet, right type of sleep. Everybody sleeps at different times, but everybody should have at least listen to their body so that they can see where the body needs more sleep also, and the lifestyle. So if we are following those, then the chances of accumulation of digestive impurities, which is called as a AMA, metabolic waste in the body, is very, very less. And if we are misusing or overusing of mind, body, emotions, or senses, then it will put at the risk of all the imbalances which menopause is going to bring or bringing in our life. How we can manage those symptoms? Ayurveda treatment options, if we see that, there are 3 sub-pillars, as I said: Ahar, Nidra, Brahmacharya. Ahar means diet, Nidra means sleep, Brahmacharya means control use of senses. But here I have added the 3rd pillar as a Aushadhi also. Aushadhi means herbal support also, through the spices and through some vegetables and through some of the lentils also. Now, if we see the basic of Ayurvedic therapies in menopause is related to, first you correct the dosha imbalance through diet and the herbs. For Vata dominant people, Vata's nature is cold in nature. So start adding the food which is warming in nature, which you prepare fresh and contain certain spices which will be helpful in balancing the Vata dosha. Little bit of oil in the form of good clarified butter, means ghee, and healthy oils, not the seed oils, not the canola oil, not the vegetable oil. Those are the very harmful oil. Olive oil or the sesame oil or the peanut oil, those in a moderation can be added into the diet. And for pitta dominant, if the pitta people, they indulge in the spicy food, so you alter the diet according to non-spicy or mild spices, having controlling over the citrus intake also, and that will be helpful in the pitta dominant people to balance the pitta. For kapha dominant menopause, we see that again the coldness and the heavy things. Like for example, if you are taking a lot of cheese or you are taking cold salads, that is gonna not only impact your kapha and vata also. So in that way, if you want to consume the salads, maybe saute the vegetables, steam the vegetables, or grill the vegetables, and that can help in balancing the kapha, and add some spices like ginger powder, which will impart little bit of heat in the body, and that helps with improving the digestion also. Then there are internal detoxification which can be done, which is called as a panchkarma. And not everybody is good candidate of panchkarma, but panchkarma also helps in resetting everything. So when we say that the panchkarma resetting, like if you want the herbs or the diet or the lifestyle to work in your favor, you need to have a clean body. Means, I'll give you the analogy or the example of, take the dirty cloth. If you want to color it, the color won't come nicely. When you have a clean white cloth, no matter what color you want, it will come very nicely. So similarly, if we want the herbs or the diet to work in our favor, the body needs to be cleansed. And that cleansing can be done through the diet, can be mental cleansing, can be done through the meditation and other Ayurvedic therapies also. Then many of us goes into the different phases of life. Then we also can get into the anxiety or depression phase based upon our past experiences or not liking the changes what is happening to the body, and there the counseling always helps. Then the yoga therapy and the rasayana mean rejuvenating therapy, also helps. When it comes to the rasayana therapy, the first is, apart from the therapy, we consider food as a rasayana. So in Ayurveda, we say that krita kshirati nityastu means if you are not allergic to dairy products, milk, good quality of milk, as well as the ghee, daily intake of that work as a rejuvenating. And if you see that it contains a lot of calcium also, which our body needs to have to prevent from the osteoporosis. Similarly, uh, sesame also works as a rasayana. Sesame, it gives the oiliness, means the skin will be supple with the oiliness, plus it contains a lot of natural calcium. That also helps. In similar way, there is also a following the Dincharya, Ratricharya, Ritucharya. Lifestyle management is also there. Dincharya means your daily routine also helps. If anybody do the exercise in the evening, so I'll give you one tip. Shift the exercise in the morning time. During the exercise, if you are doing the gym especially, you are increasing the cortisol naturally, because cortisol is the hormone which helps with pushing ourselves. During the daytime, it increases naturally, and you need that to work on daily basis. But as the sun starts setting down, cortisol naturally goes down so that melatonin can kick in. That will help in our good sleep and build our immune system. So if you are doing the heavy exercise in the morning, then you are following the dincharya, means the body natural routine. But if you are doing in the evening, the cortisol will stay up for 6 to 8 hours for the female body to take the cortisol to go down. So that means you are going to bed under the cortisol, not under the melatonin. And that puts us under the risk of having the imbalance. Night routine, sleep on time, early to bed, early to rise. Ritucharya, follow the seasonal routine also. Seasonal diet plays an important role. Seasonal lifestyle plays an important role. Muscular exercise is also very important to maintain the strength and mineralization of the bones. Weight bearing exercise based upon your strength, but always learn from the expert what is good for you, because I don't want anybody to get injured if I am saying that do the muscular exercise, but that means under the guidance of somebody who is expert in that. Surya Namaskar, yoga, pranayam can also be very, very helpful to relieve the stress associated with our day-to-day life as well as menopause. Diet during menopause, we all enter in the Vata stage of life. So the diet should be Vata pacifying, not the Pitta aggravating. Add warm, well cooked food, cooked with the spices that aids in digestion, such as cumin, fennel, shatpushpa is fennel, another type of fennel, dill seeds, coriander, saffron, turmeric. These should be exclusively in your diet. Also, the diet should be low in calorie and high in nutrition, rich in iron and calcium. Ragi. If you know ragi, ragi is the amount of calcium for one serving of ragi is 448 milligram, which not even the milk contains, and ready to absorb. Ragi is also a rich source of potassium and iron. So ragi is one of the best food. It has low glycemic index, won't let your insulin fluctuate, especially for the diabetic people also. Ragi can be a good source of diet. Then the bajri also, jaggery, dates, milk products are useful. This is the Chaturvi Churna, which I always tell everybody they can make it at home. It has methi, Chandrashur, Krishna Jirika. Krishna Jirika is Yavani. And that you can mix together in equal amount and can be taken after your every meal, especially lunch and dinner. Bitter leaf is also has the astringent and bitter properties, and that also can help with your metabolism and digestion. And ingredients like dry coconut, dill seeds, fennel, white sesame seeds, black sesame seed, even the black salt can be added as per individual requirements. Support your Agni means digestion. If somebody feels that they are started getting bloating or a lot of gassiness or lack of hunger also, then have a teaspoon of grated ginger with lime and pinch of salt before and after meals. You can grate small amount of ginger, add the salt and the lemon, and let it sit for 15 minutes, and that you can have before or during the meal also and after the meals also. The tree made of CCFT, which is called as cumin, coriander, and fennel seed, equal amount again. Throughout the day, you can take, boil the seeds. I put my electric kettle, I add the seeds, and I take that water throughout the day. And include trikatu in the diet. Now, when I say trikatu in the diet, it does not mean that you include a lot. Trikatu means three katu, means which are pungent, very strong, ginger powder, long pepper, black pepper. This is the picture of long pepper. Most of you already know the ginger and black pepper. In equal amount, pinch or couple of pinch a day should be good, not more than that, because it increases the Agni also. And it is considered as a Deepan Pachan, means whatever the metabolic waste we have accumulated, it helps in eliminating that also. But as I said, less is good because it can be heat producing, and you certainly don't want the hot flashes to get aggravated because of this. And just pinch either with the milk or with the ghee or add in your food, that can be beneficial. Then we say in Ayurveda, the food is as a medicine. Since the estrogen goes down, there are phytoestrogen in the form of natural food elements, which you can add. Chickpeas, Bengal grams, black gram, soya bean, soya products, sesame seed, wheat berries, fenugreek, oats, barley, beans, lentils, yams, rice, alfalfa protein, mung beans, apple, carrots, pomegranate, uh, then coffee also in limited amount, licorice root, mint, ginseng, fennel, anise, even the bourbon, but in very small amount. That can help with as a phytoestrogens. Then there are certain Ayurveda herbal therapy also, which can be helpful in stimulating the digestion, uh, providing natural immunity, and also helps with the memory and increase vitality also. And those one of the best thing is shatavari, which is known as asparagus racemosus. You might not get the asparagus racemosus as such as a plant here, but asparagus, the Western asparagus also suffice the same purpose. So a couple of times a week, you can include asparagus in your diet, but don't consume it as raw, sauté, steamed, or grilled. That can be added. Uh, it is known as a shatavari. It is sweet in nature, little bitter in nature, and it is heavy also. It has little oiliness also. Post digestion, it is sweet and it is cold in nature. And one of the best herbal supplement for the female throughout their life. Shata means 100. Vari means female. A female who has the strength to bear 100 husbands. Even one takes a lot of toll. So that much physical and mental strength it gives to the female body. And Shatavari is the single herb mentioned in Ayurveda for throughout your all stages of life, including it helps with the post pregnancy for the lactation also. So Shatavari can be included, but before you include anything, make sure that you know your constitution, and if you know only, then only the proper dosage, everything needs to be considered before you consume Shatavari as a supplement. That's why you can consume asparagus instead of Shatavari powder. It is rich in natural phytoestrogen that helps gently and naturally may restore balance to the estrogen levels. Then there is a ashwagandha. Many of you might have known about the ashwagandha. It's a powerful antioxidant and immunomodulator, and that also provides strength, muscle mass, and relieves stress. But again, these are the strong herbs. I don't recommend anybody to take this before consulting a Ayurveda practitioner or your doctor, because ashwagandha is one of the herbs which can interact with many of Western medicines. Somebody's on blood thinner, ashwagandha is not a good choice for them. So in various ways, we need to see if they are on the prescription medicine. Some herbs can be a big no for that person. Then the triphala. Most of the people know that the triphala is just for the constipation. We use triphala for the eye health. We use triphala as a rejuvenating also, and anti-aging also. Triphala contains 3 fruits, which is a Haritki Vibhitki Amla. Amla is the Indian gooseberry, and it pacifies all the 3 doshas. And how you take the triphala, the effect of triphala will be according to that. For example, if you want it as like a in favor of your body for the Vayasthapna, means promotes the longevity, then it needs to be taken with the ghee. If we want the triphala to work for a cleansing or gentle detox or cleansing the colon, then it has to be taken at bedtime with the warm water. That's how the triphala changes the mode of action, the way we take the triphala. Then the Yashti Madhu, it is called as a licorice. It is another rasayana mentioned for the menopause in Ayurveda. Uh, Licorice, most of us knows as a that if somebody has cough and cold, licorice works for that. But licorice also helps with the menopause, also helps with the hairs, complexion, strength, and libido also. But the best part of licorice is it works on the mind. So we call it as a Medhya Rasayana, means it is brain tonic. But again, though it says simple to incorporate all these herbs, licorice is also big no if somebody is having the blood pressure, especially if it is related to the renal blood pressure, means related to the kidneys. So then the licorice can affect the function or can impact the blood pressure more. So that's why it is important to know what is good for you. That's where the Ayurveda is the science which is customized and which is according to you, not like everybody can take everything. Ayurvedic protocol for the diet, if we say that avoid overly spicy food, heavy protein food, reduce your intake of red meat if somebody is doing that. Go on the lean fish. That will be more beneficial. Fish with the bone is also helpful. And avoid the shellfish also. Then recommended food as a medicine, pomegranate juice, freshly squeezed, not from the bottle. That along with the 5 drops of lemon juice, half cup twice a day can be taken. Wild yam, I cannot emphasize on this one. Wild yam is one of the best natural thing for the person who is going through perimenopause and menopause, unless until you have the diabetes or pre-diabetic. Wild yam helps with balancing the hormone, and that can be consumed safely as a part of your meal from at least 4 to 5 times a week. How you can consume? You can roast it, have it as a snack. You can make a soup out of that. You can grill it and chop it and has a vegetable, or you can cook like the Indian way we cook the food with the spices. That also can be added in the diet. Pranayam Shitali, because if somebody is having the hot flashes or anger issue also, cooling breath, Shitali works very well. If somebody needs the how to do that, I can provide the video link for that later. Nadi Shodhana, alternative nostril breathing also, that can also be done. Basic thing is do the exercise in the form of yoga, pranayama, that can be helpful. Key pointers for making menopausal a smooth ride, if you see, for graceful transition. Diet, remove the stimulant, encourage clean and organic diet. Vihar, Vata and Pitta pacifying, perform seasonal detox, Panchakarma, under the proper guidance of Ayurveda practitioner. Then follow Achar Rasayana, means follow the moral conducts and positive attitude, which will help in preventing the depression, anxiety. Lifestyle is very, very important, especially during the winters and during this stage of life. I call this stage of life also is kind of like fall and winter transition for all of us. And that is also important that you keep talking to your friends, make good connections, and that always helps in soothing or therapy for the mind. And think as an opportunity for the self-reflection, be mindful, take care of yourself, and that's how this will be a smooth ride. But if you still experience something, then talk to your doctor, or if you need a help from Ayurveda, you can always consult a Ayurveda practitioner also, and that way everybody can pitch in and provide you needed help for that. So menopause is, we say that it's not a disease, but it is a transitionary phase from reproductive years to wise woman year. And I always end with this thing for all of the ages, staying in touch with your body is the key. What does that means? Because your body has the ability to tell you what is right for you, what is not right for you. And body also tells you when you are hungry, when you are sleepy, when you are tired or grumpy. It's just because we get so busy in our day-to-day life, we stop listening to our body. If my joints are aching, I'll feel okay. That's okay. Maybe tomorrow it will be fine. So I'm ignoring my body. So live in tune with nature, but always be mindful what your body is telling, because body has the ability to heal also based upon if you are listening correctly. With that, I'll ask if anybody has any question and I'll stop sharing.
Doctor, I did have a question. You mentioned that we can take lemon with grated ginger and a pinch of salt, right? Is that to be consumed with water, or how is it supposed to be consumed?
Yeah, you can consume with the water also, but the grated ginger or the chopped ginger can be added, can be having, you can have like a pickle also.
Okay. Okay. So grated ginger, it's not that we take out the juice of the grated ginger, it's with the fiber that we eat.
With the juice, with the fiber also. Rhizome. Yes,
Okay.
yes.
I have two questions. That was a
Yes.
great presentation. Thank you so much um, for all that knowledge. So my first question is, I think it's incredible that you came. I spoke to you today because I just had my OBGYN appointment. And we were talking and I was discussing with all my symptoms. And she did mention, we talked about being in perimenopausal stage of my life, the Vata stage of my life. And I'm preliminary Vata by nature. But she didn't mention so much estrogen and progesterone as much as she mentioned people tend to ignore testosterone. And women at this age also suffer from low testosterone. So she's going to be testing me for that. What are your thoughts on that?
Yeah, I think all the hormone panel, most of the OBGYN, they like to test for that. And that is a good thing because she's right in saying that many of times we see that, oh no, it's because of the estrogen, but sometimes it is the testosterone which is lacking. And, or sometimes it is the opposite way, testosterone is high. That's where you need to see, go with her recommendation, get it checked, and then we can chart out the plan.
Is there Ayurvedically, not that I'll do it yet, but Ayurvedically testosterone के लिए कुछ है that हम करते हैं?
Ashwagandha actually helps with the testosterone. There are various clinical studies has been mentioned, but as I said, the complete detailed history needs to be
Absolutely, yeah.
understood, right?
Yeah.
So, but yes, in Ayurveda there are various food also and the herbs also which has been mentioned for the testosterone or other hormone support.
And my second question is my husband, he's more pitta driven. And so, I've been looking at things like coconut water for vata and pitta is very good. But if somebody is already on some potassium medications, what would you recommend? Or can they still take the coconut water? Because, that might be too much potassium. What do you recommend in that stage as a cooling juice?
I will say that first of all, yes, coconut is very rich in water. Coconut water is rich in potassium. If somebody is already having the medication for the potassium, coconut is not a good um, food or the drink for that person. Also, same for the ragi. Also, leafy greens. Somebody has to be. I mean, the person needs to be very careful about what they are having in the food items. But for cooling the pitta, amla can be a good source. Indian gooseberry. Here we get the frozen amla, and that can be added into in the form of jams, also like amla and a little bit of date. Or amla can be added into the chutneys or can be added in the food items also. If nothing, then amla juice itself, grate the amla, and then can be done. But when it comes to the juicing or smoothies or shakes, I would mention that Ayurveda never recommended having the juice or smoothies or shakes. The reason is when you chew the food, saliva mixed with the food, saliva contains digestive enzymes, amylase or other enzymes, which helps in digesting the food. When you are doing the juicing, first thing is there is nothing to digest because there is no contact with the saliva. The second thing is your body cannot handle that fiber. It's nothing to absorb. It just goes into the body, fluctuates your sugar level or energy level, and that put the body into the crisis. So smoothies, shakes, juices are meant for the people who are medically sick, cannot chew like babies, or in old age, we are going to lose our teeth. So then that is the right time to have the juicing and all. But if they are medically fit, then having the real food, chewing the food will helpful in having the proper digestion.
Doctor, I had one more question for you. One is that I know that through diet, it is good that we can maintain or we can slow down the effects of menopause. But then, if somebody has flashes or something like that, is there something that you can eat or do to recover from it quickly?
So if somebody is having the hot flashes, uh, adding ghee in the diet can be helpful. Ghee helps in pacifying the pitta. Plus, also, if you want to have a quick action, as I said earlier, the amla is the best cooling agent. It does not aggravate the pitta, it does not aggravate the vata. Very good for the skin also. So that can be added on the as a regular part of your diet. That can be done. Apart from that, reduce the spice level, add fennel in the diet. Fennel is also cooling in nature, that can be helpful. Licorice is cooling in nature, that can be helpful. In those ways, you can add the food like ashgard, for example, that is also cooling in nature. So, ashgard curry or ashgard soup can be added in the diet on regular basis. In that way, you can balance the hot flashes.
Okay, thank you. One more thing is in terms of menopause and chronic or diseases like diabetes and high blood pressure. What is the effect of that? Is it going to be worse for somebody with diabetes and blood pressure, or is it generally the same for everybody? What is the difference that we can see there?
When it comes to the menopause, if you have chronic health concerns like diabetes or blood pressure, there might be some fluctuation in that, but not necessarily if you are taking proper medication for that or if you are maintaining the diet. Basic is just whatever you are doing before the menopause, please continue so that you can maintain those. We see some fluctuation, but that can be because of the estrogen, and that if you are on the prescription medicine, then your doctor might be able to help you in increasing or altering the dosage of that.
Doctor, I have two questions. The first one is there's a lot of things people say now in terms of dairy products. Um, like some say you should not drink milk. Go vegan, like do almond milk or oat milk and stuff like that. I mean that also helps. That also actually has major effects in terms of perimenopause. So I was curious to know, like drinking milk at a particular time, or is it really recommended not to drink milk when you're in perimenopause stage?
So if you are tolerating the milk and the milk is good quality, right now it's very hard to find the good quality of milk also.
Mm-hmm.
Because milk sometimes is loaded with the hormones, and we
Right.
are already dealing with the hormonal imbalance. So that's where the listen to your body.
Mm-hmm.
Maybe don't do the full fat milk, maybe reduce to 2% or 1%, or
Mm-hmm.
dilute the milk a little bit so that you should not be having the effect of cholesterol and all other
Uh-huh.
things in that milk.
Okay.
Yeah.
Thank you. And my second question is, like I'm in perimenopause now, like I'm 45 years old, and what I see is the anxiety that comes toward during the my menstrual cycle, the periods, has really increased. Like either before